So the shoulder initially is a ball and socket joint. So there's a humeral head, which is the ball, and the glenoid is the socket. Those are both covered in cartilage. Cartilage helps our body kind of glide and move, and that wears out. That's what arthritis is. The socket or the glenoid is surrounded by some tissue called the labrum. The labrum is a ring of tissue around the socket that helps hold it in place. Around that is the rotator cuff. The rotator cuff is a group of 4 muscles. The supraspinatus is on the top, the subscapularis is in the front, the infraspinatus and the teres minor are in the back of the shoulder. And those help, again, move our shoulder around and stabilize the shoulder itself. Above the rotator cuff is some tissue called the bursa. The bursa is some padding that's over the top of the rotator cuff that helps protect it. And above that is called your acromioclavicular joint. It's the bones that are on the top of your shoulder, and you can occasionally develop some arthritis there. In the front of your shoulder is your biceps tendon. The biceps helps kind of flex our elbow. Most people are familiar with what the muscle is, but the biceps tendon can actually be a major source of pain through the front of the shoulder, and it's something that we always need to look at. So most of the time when someone tears a biceps, it's at the elbow. In those cases, we pretty much have to do surgery all the time. However, when it's torn from the shoulder, that becomes a much longer conversation about whether or not that has to be fixed. Most people actually do pretty well if you just leave it alone. However, if you're younger, more active, that can definitely be a conversation to fix it. In different areas. So if you're having pain in the front of your shoulder, we're going to worry a little bit more about arthritis in your shoulder. I would worry about biceps tendonitis and the labrum, which is the tissue that goes around the socket. Your biceps actually inserts there. So if you have a labral tears around that area, you can also have some pain in the front of your shoulder. If you have pain on the outside of the shoulder, we're going to worry a little bit more about your rotator cuff, as well as also bursitis and tendonitis. So both of those are very common areas. People can occasionally get some pain on the top of their shoulder. That's going to be more consistent with some arthritis at that AC joint. And then sometimes, again, pain in the back of the shoulder can be consistent with some rotator cuff injuries or labral tears. That's also a time we start to worry maybe it's coming from your neck as well. If it's not getting better over the course of a few weeks, it's not getting better with ice, rest, anti-inflammatories, kind of coming in and then having it evaluate is very helpful. We can get an x-ray, make sure there's no problems with arthritis, and then from there determine whether or not this is a rotator cuff problem, a labrum problem, biceps, or bursitis, and then go from there.